Assalamualaikum warahmatullahi wabarakatuh. Hello everybody. I want to say thank you for coming my video. My name is Sabrianti Rizkana Putri, name 019. I'm from Health Polytechnic Ministry of Semarang. I'd like to give you a presentation about dementia. What is dementia? Well, I explain for the topic. One definition, what is dementia? Two signs and symptoms, what are the signs and symptoms of dementia? Cause, what happened to dementia? And for treatment of patient of dementia, what is the proper treatment for those with dementia? Dementia. Dementia can be defined as cognitive and memory disorder that can affect daily activities. People with dementia often display several disorders and change in daily behavior that are bothersome or not. Dementia is a syndrome characterized by various cognitive impairment without impaired consciousness. So, dementia is a mental decline that usually develops slowly, in which there is impaired memory, thinking, judgment, and ability to focus, and personality deterioration can occur. Illness that can be experienced by all people from various educational and cultural backgrounds, although there is no specific treatment for dementia. Medication to manage symptoms may be done. There are 5 signs and symptoms. 1. Loss of memory loss and intellectual decline. Sometimes the symptoms are so mild that they escape the attention of even experienced doctors. 2. Sufferers do not pay attention to something that is a daily event and are unable to think clearly about the events they face on a daily basis, lack initiative, and are usually offended. 3. Lack of attention in thinking. 4. Emotions that are volatile can be seen from the easy of being happy, looking out loud, then suddenly being sad to tears just because of a little other influence. Reflex appear as a sign of regression. Deterioration in the quality of functions such as sucking reflex, grasping reflex, and glabellar reflex. And 5. Language problem, difficulty communicating with others. Next. Cause what happened to dementia? The main cause of dementia is Alzheimer's disease, which is a response to chemicals that transmit signals in the brain. In the brain are found abnormal tissue called snail plaque and disorganized nerve fibers, and abnormal proteins, which cannot be seen on autopsy. 2. The second cause of dementia is successive stroke, a single stroke that is small in size and causes mild weakness or weakness that develops slowly. The small stroke gradually causes damage to brain tissue and area of the brain that is damaged to the blood flow, known as an infarction. Dementia caused by small stroke is called multi-infarct dementia. Some sufferers have high blood pressure or diabetes, both of which cause damage to blood vessels in the brain. Next. Cause of dementia according to Nugroho. 1. Dementia syndrome, with a disease whose underlying etiology is not known abnormality, namely it is present at the subcellular level or biochemical and in the enzyme system or in metabolism. To dementia syndrome with a known but untreatable etiology, the main cause in this group. A spinocerebellar degeneration disease, Feinberger subacute sclerotic leukoencephalitis, and chorea Huntington. 3. Dementia syndrome with treatable etiology of disease in this group include cardiovascular cerebral disease, metabolic disease, nutritional disturbance, and as a result of chronic intoxication. Treatment of patients of dementia. Dementia treatment is divided into 3. 1. Pharmacology, 2. Support and family roles, and symptomatic therapy. Pharmacology. Most of the time, dementia is incurable. 1. To treat Alzheimer's dementia, anti-cholesterol drugs are used such as tenofovir, rivastigmine, galantamine, and memantine. 2. Vascular dementia requires antiplatelet drugs such as aspirin, ticlopidine, clopidogrel to increase blood flow to the brain to improve cognitive impairment. 3. Dementia due to consecutive stroke cannot be treated, but its progress can be slow, are even stopped by treating high blood pressure or diabetes associated with stroke. And 4. If memory loss is caused by depression, given antidepressants such as sertraline and citalopram. Next, support and family roles. 1. Maintaining a familiar environment will help the sufferer stay oriented. A calendar, break like a wall clock with large number or a radio can also help keep sufferer oriented. To taking bath, eating, sleeping, and other activity regularly can give sufferer a sense of order. And 3. Do not scold or punish the sufferer because it will not help. It will even make things worse. And symptomatic therapy when diet, appropriate physical exercise, recreational and activity therapy, and handling of problems. So the explanation for me. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.